This is a follow-up to Scott's question, Governor. With respect, I've sat through all these press conferences and I hear good news from you about the economy and all of these things that you're doing by calling the National Guard, or all of the efforts that the hospitals are taking to hire more nurses. And meanwhile, these local officials who don't have the resources or frankly the security that you do are making these difficult decisions. And I mean, that goes to even the declaration of crisis standards of care, which is on the director for the Idaho Department of Health and Welfare. So, with respect, what difficult decisions are you willing to make as we get closer and closer to those crisis standards of care? Where does the buck stop?
I, I guess I didn't do a good enough job of going through the list of all the things we've done. Uh, we we've done a lot of things, and in fact, I don't know that there's anybody that's been a bigger advocate for changing behavior. What I want is compliance, and we're just having an issue. Of my top 10 counties, the ones with the worst numbers today, 60% of them have some kind of a mandate. That's the issue with the mandate. And in some areas it's working, but in some areas it's not. But what I want is compliance. My goal is to get compliance. That's why we've changed our messaging. But we have been talking about it since last spring about what behavioral modifications people need so that we can keep the people of Idaho safe.
And as a follow-up, Governor, thank you so much. But nothing is changing from the last time you addressed the state in a press conference capacity a month ago. And so, do you really think that Idahoans are going to change their behavior now, with nothing substantial changing in the public health order before we hit that crisis standards of care?
Well, if you look at the chart behind me, there's a lot of things we've done as far as increasing healthcare capacity. There's a lot of things what we're doing as far as making things available. And we're doing a lot of what we're doing on messaging to try and get people to comply. I've got counties that have got mask orders local by the people they know right there, and there's no compliance. I'm trying to help the messaging, whether it be a school district, whether it be a county, whether it be a health district, to get that compliance that we need. But we've done a lot of things to increase healthcare capacity. And every state around us is having the same problem.
Thank you, Governor.